Please note that the opinions and ideas shared on this podcast are those of the speakers, not the opinions of the Ogden Surgical Medical Society or its board. While medical topics will be discussed, it is not to be taken as strict medical advice, and individual clinical judgment is warranted in applying information to patient care. It is the responsibility of the listener to judge for themselves the applicability of the information discussed with regards to their medical practice.
My name is Dr. Moore. I'm the incoming president of the Ogden Surgical Medical Society, and I'm a professor of medical laboratory sciences at Weber State University and a lifestyle medicine physician. I'm here with Bryan Campbell, who many of you may know, but Bryan, I'll let you introduce yourself.
So I'm Bryan Campbell. I'm the Ogden Surgical Medical Society secretary, and I'm a practicing family physician and member of the faculty here at McCady Family Medicine Residency.
Julie Hansen is a registered dietitian as well as an intuitive eating certified counselor. She currently works at Weber State University as a nutrition adjunct professor and has a successful private practice, providing nutrition counseling, corporate speaking, and wellness coaching. Besides being involved in dietetic groups and earning many awards, her experience has benefited many corporations, camps, various universities, health departments, hospitals, clinics, athletic teams, and the media. Wow. Julie brings us over 30 years of highly diverse experience in the fields of nutrition and physical activity. She shares with us her knowledge of eating disorders, sports nutrition, weight management tips, diabetes management, media relations, recipe modification, healthy cooking, prenatal and pediatric nutrition, exercise consultation, and wellness facilitation.
So we're excited you're here. You know, nutrition is certainly part of all of our lives, whether we do it knowledgeably or not. So hopefully we'll be a little smarter at the end of the day. So let me just start out with some basics. What really happens when we eat, and how do I, for myself and my patients, try to create a healthy and wise, intentional nutrition process?
Well, first, I do like that intentional, because I think that is the key to what we want to focus on. And so being very dependable about feeding yourself is probably the first step. And that's something that a lot of people don't really talk about. I mean, we talk about it in terms of kind of being negative, but if you look at it positively, this is the best form of self-care that you can provide yourself. And depending on what stage of life you're in, it's probably going to look a little different. Some of our students that we work with, Scott and I both teach at Weber State, like when they're in their student mode, they're probably going to maybe choose different foods than when they're not in that student mode. But just being very dependable, and discipline doesn't have to be negative. The discipline of feeding yourself can actually be very positive. And so that's one of the first steps, I think, is just starting with your attitude about food and looking at it more positively and learning really, again, how to enjoy eating again.
Now, so we talk about enjoying eating, and we hear all over the place all these food everything, right? My big question is, what does a normal eating pattern look like? How can a normal person provide health to themselves by eating? And is there even a normal eating pattern for people?
Yes. I would say the majority of people do so much better with regular meals. So for most people, grazing doesn't work. I think that, you could do some maybe heavier snacks, but I think you really got to be dependable about planning meals. And I think planning is the first step. What I always call it a thinking cook. I want you to kind of think ahead. There's some things that you could do the day before. When I travel, I always freeze a turkey sandwich, and then I freeze it, and then I just take it on the plane with me, and then by the time it thaws out, I'm ready to eat it. So I, always do stuff like that, like thinking ahead. I've learned not to bring the tuna fish packets. That's not a favorite, right? Because that smell can be a little overwhelming. But anyway, but just being dependable, and if you want to eat out, that's fine. But just also realize, I think especially with the food costs now, that it's probably going to be better if we can learn to kind of plan our food. So normal eating, I think for most people, is going to look something like 3 meals a day, and supplementing with snacks. That's what a normal meal patterning would look like.
So I hear a lot about 3 meals versus 2 meals. Is there any evidence, or is there any benefit to going with either one?
Right. So I think keeping your blood sugar stable is a really great idea. So I guess depending on your habits, but the reason I like the 3 meals, because it helps us get more nutrition in. And then chances are, if we kind of avoid getting too hungry, when we get too hungry is when we start reaching for things that we normally probably wouldn't eat, or we just go out and eat something quick. But if we can keep ourselves in the kind of the polite hunger stage, then we are able to choose appropriately. It kind of puts us more in control of our eating than when we're famished. So that's why I like the 3 meals. There is research to show, that keeps your blood sugar more stable. Mm-hmm. So, and I need snacks. I can't always make it from meal to meal. So I also need snacks, and most of my patients do too.
I like that.
Which is nice to hear, because, some people really are critical of snacks, but depending on what you put in your mouth, it can actually be okay.
Right.
So I'm preparing for my board exam again. We take it every 10 years. And some of the questions on the board practice exams that I've been seeing have to do with the poor parent who is trying to deal with the small child who will eat nothing. And so the poor parents give up and start feeding them sugary foods that they'll actually at least put into their mouth. And the poor mom or dad feel like there's just no hope. There's no way they can have this child have anything reasonable to eat. So what's your advice regarding that dilemma?
Yeah. So kind of what our whole, premise today, and one of the things that I really want to introduce is the feeding relationship. So the feeding relationship between the parents, and I know we have questions kind of coming into this too, but what is the parent's responsibility in feeding and what is the child's? And I do want to show you guys too, one of the books that I really, really like, Ellen Satter, and then we will link to this in the notes. And then the other book that I really like is her book called Secrets of Feeding a Healthy Family. And so within this, it is this feeding relationship. And there's also, she has a website too where you can download these handouts that describe this as well. It wouldn't, matter really what income level to get this started. It's going to make life so much easier. And I have to tell you that I implemented her feeding strategies for my children. I have 2 children. And I also have a twin brother who did not implement these feeding strategies. And he had kids before I did. And I was thinking that was always the best birth control ever, was to go to his house for dinner. Because it was all this fighting over food. And I'm like, holy cow, this is crazy. So I don't know if you guys grew up that way, or, I had my own food battles with my parents when I was growing up too. I had to clean my plate and all that stuff. But what her premise is, so the parent, and I can really simplify feeding for everybody, but the parent's job is the what, where, and when of feeding. So in other words, what food's going to be served, where is it going to be served, and what time is it going to be served? And the children's job is if they eat and how much. Now, obviously, this is going to work better with older children, like 3 years and over, it's going to be a little bit easier. But even with an infant, to be fed on demand is really important, because that establishes the feeding relationship from the beginning. And when I had my daughter, I remember the doctor telling me to put her on a feeding schedule. And I just told him, no, she will be putting me on a feeding schedule. And so when that child knows that their needs are going to get met from the get-go, from the very beginning, it starts to develop that trust in that feeding relationship. So then as these children grow, they want to mature in regards to eating. They want to grow up and eat. And so we really need to learn to trust them to be able to figure out the if and how much. And so what that might look like for parents is they don't cater to the kids. So, these, low income families or a single parent, they don't have to do short order cooking for each kid's needs. They feed the kids. It's not mean to feed the kids what the parents eat. That's not mean. I mean, you can make some considerations. Like, for instance, if I made, let's say, chicken enchiladas, and I knew my kids that might be too much for them, I would probably separate it out. Like, maybe I would get the meat out and maybe the rice and the tortilla, so maybe it would all be plain on their plates. It wouldn't necessarily be in the form of the enchiladas, but I'm not going to make anything else. And maybe what they end up eating is they drink their milk, some tortilla, and snack is at 7 o'clock before you go to bed. So sometimes parents, we do that dance of, you've got to finish your meal before you get your dessert or before you get your snack. Like, that's not the way to go. Like, nobody wins that food battle. You may think you did, but you really didn't. And there's other things to fight about other than food. So I just always said, here's what we're having at snack. So I would get there first. I would get there and go, okay, here's what our snack, maybe I'd give them a choice, maybe I wouldn't, but I had control of that. And one of the other things I learned early on too was if I put the menu up of what we were having for dinner, like at breakfast, then my kids would get all the icks and yucks out of the way. And then by the time they came to dinner, it was like, okay, this is what we're having. My son was so funny. Like, he was so into breakfast. Like, he would talk about breakfast at lunch the day before. Like, whatever he was hilarious. He loved breakfast. Anyway, so I do think that really that can help, not caving in necessarily, but having that structure and that develop that feeding relationship early on has so many great paybacks later. And so fast forward to when my kids were around my brother and his kids, I mean, my sister-in-law would always comment that your kids eat anything. And I'm like, I know. And, they just did. That's just all they knew. So.
Yeah,
I think those are wonderful. We've actually kind of covered several of our other questions here, but it does lead me to ask one further question. With your son loving breakfast, what's a good breakfast, or what are some good breakfasts?
Yeah. Well, okay, so this is so funny because one of his favorite breakfasts was mini wheats, but he liked the strawberry ones. So he'd always say, Mom, can you get me some pink minis? I don't know why that always cracked me up. So again, I think sometimes we get so worried about the what that we kind of start to maybe limit foods that really shouldn't be limited. So pink mini wheats, that's what he ate. It's got fiber in there. He would have milk with it. I can't remember what kind of cereal my daughter would have, but literally, like, they would almost, like, they would get out of bed, grab their cereal, head to the table. So they ate, right? And how many kids don't eat breakfast, right? So they're already ahead of the game. But I mean, I love like a combination of protein and carbohydrates and fiber. Like, that's a great breakfast. So, eggs and fruit or toast, the cereal, the milk, some fruit, just that whole combination, peanut butter, toast, anything, now we have these protein shakes. If they can add some fruit and peanut butter to that, like, I'm so happy. Whatever we can do. So some things, just are easy. And we have different kinds of bars now that people can eat. But I think it's, again, the focus of my kids eat breakfast. Like, I'm so excited about that, So, and they still do.
Excellent.
So, we kind of went over some big things. And for me, as a parent, struggling with very, very defiant 7-year-old twins and a 4 or a 5-year-old, she just turned 5.
Okay.
They're very independent and they know
Okay.
what they want and what they don't want.
Mm-hmm.
So there are nights, I will not say how many, but there are nights where we do make more than one meal.
But what if we tried not doing that? But here's the key. Put something on the table they'll eat, whether it's bread, milk, whatever, because the consequence of this is, and I don't know if you do a bedtime snack, but I always did. And so the consequence would be that they would be hungry, which for a kid, even being hungry for an hour can be uncomfortable. But that's the consequence. Here's your decision to not eat this, and but snack will be at 7, and so that'll be great. You can eat then.
Yeah.
So, do you know what I mean? Like, so what's some examples? Like, give me some examples what they do.
So, the most defiant one, she will say, "Oh yeah, like I'll have a burrito. That'll be perfect." And my kids love burritos. And then she gets the burrito at the table. She's like, "No, not gonna do it."
That's what you got. Yeah. So snacks at 7.
Yeah. Okay.
Okay.
I like that.
Let's do it. Let's just do it. So kids
Deal.
actually seriously will adapt. It may take a week or 2 weeks, but they'll adapt. You know, that's the thing, is they're actually really pretty flexible once we do it. But here's the other thing. Maybe you guys want to try doing the menu thing, you know, putting up a menu, but then maybe the kids get to pick one night or something that they get to pick something they want, or however you want to do it, you know, so that they can get involved in, you know, the feeding at the table as well, the menu, so they feel like they've got some control. But if she changes her mind, oh well, let's just have a nice conversation, and you know, you probably are going to get hungry, but oh well.
That's a good idea. I'm going to propose that to my wife. Thank you.
Mm-hmm.
It's a great one.
Yeah, it's really so easy, seriously.
That leads me to another question. You know, our children are good at knowing if and how much they eat, right? But it's our job to determine what, when, and where, right?
Mm-hmm.
So what are our children's eating capabilities?
Right. So this is great. So kids actually want to grow up. I mean, their whole thing is they want to grow up, they want to get independent, and they want to mature. And eating is no different. So they really want to, you know, be able to have more eating experiences, and they obviously can do better with feeding themselves too as they grow up. And we can also predict that those kids are going to grow as well. You know, if something changes, then that's when we, you know, need to look at something that might be going on. But the majority of kids are going to eat a variety of foods. They're going to grow predictably, and they are going to mature with respect to eating. So keeping in mind that you want to keep, you know, we don't want to go down and eat at their table. We want them to come and eat at our table. So I think that that's okay to expect them to have some different eating adventures. And if they decide they don't like it, you know, again, have something on the table, you know, they'll eat, and life will be good. But they've got really good eating capabilities. Yeah, they're actually born intuitive eaters. It's just that sometimes we kind of mess them up. We're well-intentioned. I mean, parents are well-intentioned, you know, so.
So we're going to a bit of a segue here. So we notice that Ogden is a very diverse community. And in some places we have ready access to nutrition at the store, but there are also places that really do rank as food deserts, where there really is no convenient place to get food. But we note here that sometimes it's more like a food swamp. Everywhere we look, we have food available, but those are poor choices. And we certainly see that in some of our fast food restaurants, where there is some clear challenges to those that are regularly using that as a resource for their food. So when we look at the challenge of excessive weight gain, what kind of thoughts should we be sharing with our patients as far as how they should approach the challenges of where to get food, what kind of costs they should be looking at, how do they move from where they are if they're unhappy with their current setting to moving into a safer, better place?
Yeah. So I guess I would ask them, you know, do they do any food planning at all? Are they capable of that? Because, you know, beans and rice is pretty cheap, you know, and you can do a lot with that. You know, you can do a lot of rice bowls that, you know, that are something that, you know, kids would probably eat, and parents. I still think it comes down to planning, you know, and I know some of these patients just haven't really thought about that. You know, their life is probably chaotic, you know, they're just living paycheck to paycheck. They're, you know, barely able to kind of know what's going to happen the next day. But that truly is the key. If they can do any type of prepping, you know, you can freeze peanut butter and jelly sandwiches. You can freeze those. And so grabbing them, I'm a big, like, let's freeze sandwiches. I have all these debates sometimes with my teenage clients, because they're always like, that's gross. I said, no, try it. And so they try it, and they're like, oh yeah, that wasn't so bad. So you really can freeze all of that stuff, and then it's all ready to go. And so one of my clients, we realized that she's very forgetful. So we decided to take her phone case and put it in the freezer or put it in the fridge so she would not forget her food that she prepped. Because, you know, we used to say put your keys in there, but you can't always, now with these new keys, I don't know if that's a good idea. But anyway, but something that I think that they could start doing ahead of time. So very simple prepping. You know, what are some ways that they could do that, you know? Because, I mean, peanut butter and bread is pretty, well, for the most part, pretty cheap. Everything's gone up. But, you know, things like that, I guess. And cereals, you know, trying to focus on some of the lower cost meals that are good. So a lot of even, you know, plant-based foods are a little bit cheaper right now, too.
Really like that. Now, that kind of brings us into, you know, as we're planning, there are a lot of misunderstandings about food, a ton of them. And
right.
So what things that we as the public think are health promoting, but actually they might contain a ton of calories or other deleterious substances for either our health and growth or children's health and growth. What are some of those foods?
I was kind of thinking about this, and, you know, if we look at the feeding relationship, like, let's say if people really are attuned, if they're learning trust in their bodies and the fact that, yeah, I can tell when I'm getting full, you know, you can sit down to a fettuccine Alfredo and you probably won't finish it. So if there's more nutrient, a lot of hidden calories in there, your body eventually is going to detect it. I really couldn't think necessarily, I don't know, Scott, do you have any ideas of what those foods are? I'm not really thinking what they are. Like, I mean, I think that, again, all foods can fit, and I wouldn't choose, you know, again, if the parent is a gatekeeper, so typically it might be the mom or the dad, but they're the gatekeeper of the nutrition of what's coming into the house. And so that person really you know, has a lot of that responsibility. They get to decide if that food is going to be there or not, you know, so they can decide. They don't necessarily have to buy soda, you know, they don't have to do that. They get to decide if they're gonna. You know, I remember growing up, like when we had soda, it was like on Friday night, you know, it was kind of a big, you know, kind of a big deal, you know, so I do sometimes a little bit worried about that maybe that's displacing some of the nutrition in places, and because soda's cheap, right? So I probably say that's probably my one worry of food, but otherwise I think that if we can maybe look at not demonizing food and not seeing food as good or bad, because then kids learn that they're good or bad. And so really allowing foods in, but the parent still has all the responsibility. But I don't know if I'm answering your question. So I don't know if you had an example.
I guess I did have some thoughts, and
Okay.
I'm just thinking of like kids and what common things that kids eat or they'll bring home from parties or something like that. And, you know, one of the big ones I was thinking of are fruit snacks.
Oh, yeah.
There's no fruit in fruit snacks.
Yeah, right.
And so we think that they're not too bad, or like fruit juice, like it's the Capri Sun, like it's nothing but water and sugar, and flavoring.
Right. You know, again, if they're going to get them at, you know, soccer practice or whatever, you know, that's one thing. But again, the gatekeeper gets to decide if they want to have them in the house or not, right? So they get to decide that, you know, and kids are going to be exposed to a lot of that. So I think it's, you know, again, not if we make it a big deal. If the kids think they're not going to get it again, or it's a restricted food, they might tend to overeat it. So, okay, so here's a great example. So my kids, I make cookies all the time. Like I still make cookies, like I bake all the time. And, you know, my kids grew up and they're like, you know, cookies are normal. They never really thought about it. So I remember one time we went to this party when we first moved here. My kids were little. A neighbor went with us, and her kids were restricted from that kind of stuff. I mean, they never got it. So what do you think at the party my kids were doing versus what her kids were doing? My kids were playing. Her kids were at the table eating. Like they were just knocking all that down. And so it's like when you normalize food, it just kind of loses its appeal, you know?
I think that based on what you've said so far, I would suspect that you would encourage parents to avoid using food as either a reward or a punishment. Right,
exactly. Yeah. And, you know, within reason, like sometimes it is sort of fun to go celebrate, like we're going to go out to eat after a soccer game, you know, well, you know, that kind of stuff. But yeah, like learning, you know, not allowing food to soothe emotions, I guess, is probably one of the things. Like kids probably would appreciate experiences more than anything. And it's really hard in the school system because I know that's the way it's set up. You know, Scott, you kind of said that, you know, kids come home with all this stuff at school. And like, I remember my kids coming home with those big I don't know what they were, like they had like sweet tart stuff in there, like big
Oh, yeah.
sticks, pixie sticks.
Yeah.
But they were gigantic, and I'm thinking, holy cow, you're not going to feel good if you eat that.
Wow.
But it's up to you, you know. But it's like, but it's so easy to reward kids with that. It's cheaper too. I kind of wish we could get away from that and maybe give them, you know, something else that they could, you know, feel good about, right?
Like an orange?
Yeah.
Yeah.
Although one time I did give raisins away for Halloween, and that didn't go well. My kids have never let me forget that. So
what I typically do is I dehydrate my own pineapple. And so I'll go to Sam's Club and I'll buy like 6 boxes of pineapple, and I'll just be cutting up pineapple for a long time. I got to wear gloves because I didn't do that one time, and that was a big mistake. But then I'll dehydrate my own pineapple, and then I'll just hand those out at like Halloween or at, you know, kids' parties or something like that, and they love them. They go like candy.
that's awesome.
Yeah.
Our neighbor used to do pencils, and she would put them on a silver tray. And so when she opened the door for Halloween, it would be these pencils on a silver tray, and the kids got to pick out what they wanted. I thought that was cool.
That's cool.
Yeah.
I like that.
So again, a bit of a change here is, in your experience, have you seen any behaviors that parents can unfortunately slip into that might tend to lead a child towards an eating disorder?
Right. So I do think parents, again, are very well intended. But I think with all these nutrition rules that circulate out there, and the diet mentality is kind of what we call it, that can kind of mingle into what happens at the table and what foods are brought into the house. So sometimes that can look very restrictive for kids. You know, they kind of learn early on that, you know, sugar's bad, you shouldn't have it. And so food doesn't taste good in their house. And they feel like maybe their parents are always monitoring them and not wanting them to overeat, or, you know, so it's kind of when parents bring their concerns to the table, like their inability to manage their feeding makes them unable to manage their child's. So they're obviously crossing that division of responsibility in feeding. So I always come back to that. So when we have that crossover is when kids feel like they can't be trusted, they don't know how to eat, and that just sort of continues as they get older. So if parents are always dieting, you know, trying intermittent fasting or keto or any of that, kids are watching and they're observing that. And again, it goes back to the good versus bad. The kids become good or bad based on what they're eating.
So is this also, I mean, is it kind of watching the parental eating patterns? Is that also why it's good? Because we hear it's always good to have meals with your family together. And I'm sure there's a ton of different reasons, but is that one of the big reasons why?
Yeah, you guys, you know what? I think if you know what you're having for dinner, your day's going to turn out well. Of course, maybe, you know, that's my life. But anyway, like if I have something in the slow cooker, I'm thinking, got my day conquered. But then everybody knows what they're having. Like it's just so dependable. And so then it's worth saving your appetite for. You know, if you know what you're having for dinner and when you're going to eat, then it's like, okay, I'm good. I can have breakfast and lunch, and I'll need to time my snack out right. I mean, this is an adult talking, you know, and then I'm going to be ready to go to the table hungry. You know, we want kids to go to the table hungry. You know, we want that to happen. So we want to have foods we enjoy too, that we look forward to eating. And again, Scott, you know, you don't want to fix foods all the time that your kids are going to eat, right? You want to have food that sounds good also. Yeah, so I think that, the family meal, you know, when you look at the research, you know, kids do better in school. They have better relationships with not only their family, but with others. They tend to do less drugs, you know. And, you know, I don't know how you guys grew up, but I remember, like, my mom was so adamant about a family meal. Like, we always had family meals. And now, you know, I listen to my patient schedules, and I'm like, holy cow, this one has soccer practice, and another has soccer practice, and you really have to think ahead.
So as we look at physician training, many of us have truly minimal training in nutrition. What would you suggest to those of us that are already in practice as far as resources for us to help our patients?
Right. So I will say that her website has a lot of great stuff. You know, those handouts, you could make copies of her handouts of the division of responsibility in feeding. And they've also got little webinars too that for patients and professionals. I think most people love hearing this, right? Like, it's kind of a relief, right, Scott? Like, to hear that, you have your responsibility in feeding and your kid have theirs, and you just don't cross the line. And yeah, there might be a little bit of conflict at first, but when it finally settles down, like, that sets your kid up so well to eat as an adult, like to be able to regulate their eating so that we can avoid, any weight fluctuations, and that your child will grow into a body that's right for them, And that's the other piece I wanted to say too, that it's really not the parent's job to control their child's weight. It's their job to promote this feeding relationship, and that's kind of where it needs to end. Like, they don't necessarily have to control their child's body. She also has the division of responsibility and activity too. So she has kind of a handout on that as well. Cool. So helping promote activity in children also. But Ellen Satter, I got the opportunity she's a dietitian and a social worker, and kind of started like this whole feeding dynamics, and she's done a lot of research, and got to meet her several years ago when I was in Colorado. We brought her out to speak, and she was amazing.
That's a really cool combination, a dietitian and a social worker. Like,
I know.
Holy cow.
I know. Yeah, and she's got some great videos. Like, I taught a class at Weber State on childhood, and we would watch her feeding. And it was just so cool to watch this at the table, what would happen, with the parents. And then you can see all the divisions that are crossed over, right? The ones that do it well and the ones that don't do it well.
Now, Julie, you mentioned that you like a not so common hobby. You really like to do archery and agility with your dog. Can you talk a little bit about that? That's kind of fun.
Yes. So in 2020, my husband and I, we were celebrating our 30th wedding anniversary, and we were going to go on a big trip, but then of course we couldn't. And so I just said to him, why don't we do archery? So we started doing archery. He'd done it before, but I never had. So that was sort of something that he and I can do together, especially as we age. I'm always trying to find things that he and I can do together. So love that. It's very meditative. I love it. I have had so much fun with it. And we're going to eventually compete, I think.
Cool.
So, right. And then agility with my dog. So, I grew up with animals, but I grew up with horses, and I would show horses. But, with the horse, you have control of the animal, with the reins and stuff. But with your dog, like, I was thinking, how in the world is this supposed to work? But I've been doing this for about 4 years, and my dog, she's a whippet, and she does really well at it. And we go to classes once a week, and we just have a blast. We do competitions every so often, and you never know necessarily what your dog's going to do, but it's just the relationship between she and I. It's just so much fun.
That's so cool. That's pretty dang cool.
So I have one other question for you. As we look at the future, what are you hoping to teach us at the formal Ogden Surgical Medical Society presentation?
Right, yeah. So what I want to do there is kind of continue this discussion, but also looking at how physicians can handle weight issues with their clients. Like, if your patients are underweight, like, what are some questions to ask? What are some ways that these eating disorders don't slip through your fingers, and how can we get these kids appropriate help? Because I find that a lot of my patients, things are missed, I guess. So want to know what questions to ask, and also just, I guess, equip physicians better to handle that. And then also on the other spectrum, how do you handle children that are overweight? Like, what are the questions to ask with that too? So, because both can represent, being on that eating disorder continuum, we need to ask the right questions. So, and how can you set up your office to make that something that the children feel comfortable in too?
Well, that's actually quite exciting.
Julie, thank you so much for being here.
Thank you very much.